Well, joining us for more on the COVID-19 situation in Bauchi is the state's epidemiologist, Mr. Ajib G. Gandhi. He joins us via Zoom. Thank you for joining us on the program.
Thank you for having me.
Now, Bauchi has come a long way from one case to 1,540 confirmed cases, 17 deaths and over 1,500 recoveries. And now we understand that 8 persons are undergoing treatment. Tell us a bit more about the efforts of the state government to curb the infection rates in the state.
Thank you very much, Walker. Bauchi State has done so much to curb the spread of COVID-19 in the state and in the country as a whole. We have been working together with, in collaboration with the Nigeria Centers for Disease Control, and specifically some of the activities conducted by the Bauchi State government include collaboration with partners in the state to provide the basic essential control measures. Such partners include WHO, UNICEF, Bill and Melinda Gates Foundation, and many more. And some of these activities include training of our health personnel on how to handle such cases, designation of treatment facilities in the state, procurement of case management drugs, which the state has been providing for all that tested positive and were managed in the designated facilities. These designated facilities were across, 6 of them across the state, which include the General Hospital Vayara, Abubakar Tafawa Balewa University Teaching Hospital, the Bauchi State Specialist Hospital, Federal Medical Center Azare, General Hospital Toro, and even the Correctional Center in Bauchi here, where when we tested some of the inmates, they tested positive, and the state had to provide them a treatment facility there within the prison yard.
So looking at the daily numbers that, states are recording, and particular to Bauchi, is it over? Is the pandemic over?
No, I can't say that the pandemic is over in Bauchi, but we have really recorded substantial progress in containing the spread of the virus in the state. Our positivity rate so far is about 6.9 or 7% so far. So we can say that we are at the top of the situation in the state, and God helping us, will get to a 0 point in time to come.
Is testing still ongoing? Are you still performing random tests for COVID-19, or is it all still in line with the case definitions which we were told at the beginning of this pandemic?
Well, we have done both in the state. We have done both the random testing and using the case definition. Recently, when we received a directive from the Presidential Task Force for each state to collect about 10,000 samples, the state has done that, guiding us using the case definition, and we have recruited over 7,000 people, whom we have tested over 5,000 now. And out of these 5,000, still, as I've said, our positivity rate is still within 6-7%. So the virus is really not spreading fast or much in the state.
Finally, as Ramadan begins, what are those measures that residents need to take into cognizance to prevent transmission, to limit the spread, and to be safe?
Well, we have been intensifying our risk communication campaign across the state, and we emphasize that people should ensure the observance of the non-pharmaceutical measures, which includes frequent hand washing, use of face masks, maintaining social distancing. We have been emphasizing that, and the risk communication team, under the leadership of the State Commissioner for Information, have been doing that and had meetings with the ulamas who will be heading the tafsirs during the Ramadan to ensure that such measures are taken during the tafsir and even during Jumat prayers.
Indeed, we would like to appreciate your time. Thank you for joining us on the program, the Bauchi State Epidemiologist, Mr. Jib G. Gandhi. Thank you.
My pleasure. Thank you very much.